All right, guys, we want to address knee pain with some of our runners and some of the things that we tend to see as common faults with our runners. One of the things that we see a lot in people's stride is that when they go into hip extension, their foot kicks out into that externally rotated position. And then when they come through, the foot is already primed and positioned to stay turned out. So the foot makes contact here, the knee wobbles in for stability as they come through into that next turnover. So why is that a bad thing? Well, when my foot hits the ground turned out there, I'm starting to rob my hip of its ability to generate stability. If my foot lands straight, I'm far more likely to maintain a stable position, and my hip is going to be far better positioned to be stable as I come through into that next foot strike. So what are we talking about here as far as what our fix is or what our problem is? Our problem here is internal hip rotation often, not always, but often. When we lack internal hip rotation, I go into extension and I can't internally rotate, meaning when my foot comes back behind me here, my hip should be gently internally rotated. That then primes my foot to hit the ground straight as I come through. All right, so if I'm lacking hip internal range of motion, that's going to rob me of that ability, and I'm going to work around by kicking out here and then again coming through primed for my foot to land externally rotated. So if we come over to Justin here, go ahead and lay down for me real quick, Justin. How do we look at internal hip rotation? So Justin's going to give me his leg here. We're going to just gently rotate the foot out here and see where do we hit kind of the invisible wall here of his internal range of motion. So Justin's been working on his internal range of motion, and it's not bad, but it could be a little better here. But for a lot of our people that deal with that mechanic with the running, we literally hit that wall like here, okay? So like there's no internal hip range of motion. So when there's no hip internal range of motion, we're gonna get some sort of compensation, and that's often what we see. All right, guys, one of our favorite mobilizations for internal range of motion of the hip is this guy here. So you need a PVC pipe. We've got some Buddha floss to kind of strap it to my leg here. I'm gonna hold my leg up here. So my leg is basically kind of relaxed here. And I'm gonna just gently internally rotate my hip, and I'm gonna kind of find my own invisible wall here, right? My own, where do I kind of run out of that passive range of motion? I'm not really forcing it beyond anything that just kind of feels uncomfortable at all. So I'm not uncomfortable here at all. So I'm gonna hit that end range, then I'm gonna gently do a little contract and relax here. So I'm gonna, via my hip, I'm gonna gently contract against myself. So I'm trying to rotate my foot back to this position, but I'm not gonna let myself. So I'm gonna hold the pipe here. I'm contracting gently through my hip. I'm gonna breathe into this position. So I'm gonna hold here for about a 3 to maybe 5 count. At the end of that count, I'm gonna inhale and exhale, and I'm gonna relax both the tension in my hip and that breath, okay? So a couple things that we want to think about here, guys, is connecting our breath to our movement here. So as I get to end range position, I want to be able to breathe into that position. Take some deep breaths in and out. Kind of calm and relax the system there with that breathing. Then I'm going to contract. Ready, here we go. Contract, 1, 2, 3. Big inhale in. And release and relax. And what we find there is on that relax, I'm able just to get a little more range of motion. So the idea here, guys, is with that contract and relax, I'm going to just gently start moving that invisible wall over, okay? Our rule of thumb with contract and relax, what we want to do is for every 1 second that we're contracting, we're going to relax for 2 seconds, maybe 3, and really focus on that breath work. So if we tie our breathing into it, one thing I like to do is we'll contract. As we relax, we're going to take 2 to 3 deep breaths in and out, and then we'll do another contract. Give that one a shot.